Okay, so today we're taking a deep dive into a proposed bill.
Oh, interesting.
Yeah, it's from back in 2021
Okay, okay.
called the Treat and Reduce Obesity Act of 2021.
Uh,
And, it was aiming to tackle this obesity epidemic in America.
right.
And it's pretty alarming, some of these statistics, We're talking like nearly half
Wow.
of all Medicare beneficiaries
Hmm.
could potentially be dealing with obesity by 2030.
That's a lot of people.
Yeah,
Yeah.
that's huge. So we're going to kind of unpack what this bill proposed,
Yeah.
why it matters,
Right.
and maybe even uncover some potential game changers in how we approach, this whole crisis.
Yeah, I mean, this is a topic that I think is really important. I've spent years analyzing healthcare legislation,
Right.
and, this bill kind of stands out
Yeah.
because it really tries to look at this complex issue from a lot of different angles.
I think that's a great way to put it. So let's get into some of the details here. The bill starts off by painting a pretty stark picture of where things stand.
Yeah.
What were some of the key findings that, jumped out at you?
Well, one of the things that I thought was really striking
Yeah.
was that back in 2015, 2016,
Okay.
over 41% of adults over 60 already had obesity.
Wow.
And the financial burden is huge, too. We're talking like $50 billion
Wow.
spent by Medicare on obesity-related issues in 2014 alone.
Just in 2014.
Yeah. But what really hit home for me was, this isn't just about numbers.
Right.
It's about people's lives.
Right.
Think about the impact on someone's quality of life,
Yeah.
their ability to do like everyday activities,
Yeah.
even their lifespan.
Right. Yeah. That's such a good point. It's easy to get lost in the statistics sometimes.
Yeah.
But we're talking about real people facing real challenges,
Absolutely.
So how did this bill propose to actually address this?
Well, it really focused on two main strategies.
Okay.
Expanding Medicare coverage for intensive behavioral therapy
Okay.
and obesity medication. So it's kind of this two-pronged approach,
Right.
recognizes the complexity of obesity.
I'm curious about that intensive behavioral therapy piece.
Yeah.
What does that actually involve? If for someone who's seeking treatment?
Well, it's not as simple as just telling someone, hey, you should eat less and exercise more.
Right.
It's really about having a structured program
Okay.
where you're working with qualified professionals
Right.
to change your eating habits, to increase your physical activity,
Right.
and even to address some of those underlying emotional or behavioral factors
Yeah.
that might be contributing to their weight gain.
Yeah. So it's like a much more holistic approach, getting to the root of the problem, it sounds like.
Absolutely.
And the bill proposed expanding access to this, right? To this type of therapy.
Exactly.
Yeah.
It was suggesting that we allow more types of healthcare providers
Okay.
to offer these services.
Okay.
So, not just physicians,
Gotcha.
but also like physician assistants, nurse practitioners, registered dietitians,
Okay.
really expanding that pool
Right.
of qualified providers.
Yeah.
And I think that could be a real game changer, especially
Yeah.
for folks in underserved communities
Right.
where, specialist care might be limited.
Yeah. That makes a lot of sense, breaking down those barriers to access.
Right.
Now, the other piece of this puzzle was medication.
Yeah.
And I know there are a lot of different types of medications out there.
Right.
What kinds of obesity medications were they considering for coverage under Medicare Part D?
So first, it's important to understand that Medicare Part D is the part of Medicare.
Okay.
That helps cover the cost of prescription drugs.
Okay.
And when it comes to obesity medications, there's actually a few different categories.
What?
So some medications really work by working on certain hormones in the brain
Okay.
that help regulate appetite.
Gotcha.
Others may impact how the body stores fat or even how it absorbs calories.
Wow. Okay.
So it's important to remember that medication isn't like this magic bullet,
Yeah.
but it can be an important tool for some people,
Right.
especially when combined with lifestyle changes.
Yeah. So it sounds like this bill was trying to create
Right.
a more comprehensive
Yeah.
and an accessible system for treating obesity
Absolutely.
through both the behavioral therapy
Right.
and the medication.
Right.
But didn't it also include some requirements?
Yeah.
Like needing a referral from a doctor?
Yes. The bill proposed that Medicare coverage for both behavioral therapy and obesity medication
Okay.
would require a referral
Okay.
from a physician or primary care practitioner.
I can see how that could be beneficial, right? In terms of ensuring that people are getting appropriate medical oversight
Right.
and coordinated care, right?
Yeah.
But did the bill address any potential downsides to that requirement?
That's a great question.
Yeah.
While referrals can be really beneficial,
Yeah.
they can also create barriers for some individuals.
Yeah.
So imagine someone
Yeah.
who's ready. They're motivated to seek treatment,
Right.
but they face hurdles
Right.
in getting that initial referral. That
Yeah.
delay
Yeah.
can be really discouraging.
Totally.
And for some people, it might be, the difference between seeking help
Right.
and giving up.
That's a really important point. It's about striking that balance, right?
Yeah.
Between ensuring proper medical guidance
Right.
and making the process as accessible as possible.
Absolutely. It
Yeah.
is. It is. And that's where the details of the implementation become really important.
Right.
How would this referral process actually work?
Right.
Would there be support systems in place to help people kind of navigate that?
Yeah, that makes a lot of sense.
Yeah.
It's not just about, writing a bill.
Right.
It's about making sure that it translates
I know.
into real world solutions that actually work for people.
Yeah.
You mentioned earlier that the bill also highlighted like the economic burden
Yeah.
of obesity.
Yeah.
What were some of the key takeaways there?
Well, one figure that I thought was really striking was that
Okay.
a Medicare beneficiary with obesity
Okay.
costs, on average, over $2,000 more
Wow.
per year than a healthy weight beneficiary.
That's a significant difference.
Yeah, it adds up quickly,
Yeah.
both for individuals and for the healthcare system as a whole.
Wow. So you're saying that like tackling obesity could actually save money
Oh, absolutely.
in the long run.
Yeah, think about it.
Yeah.
Think about the potential reduction in costs related to things like diabetes,
Right.
heart disease, and other obesity-related illnesses.
Yeah.
It's really an investment in
Yeah.
a healthier future,
Yeah.
not just for individuals, but for society as a whole.
That's a really compelling argument.
Yeah.
It shifts the perspective from like
Right.
obesity being this like cost burden
Right.
to potentially being an area where we can see a return on investment in terms
Yeah.
of healthcare savings.
Exactly.
I'm also curious about the bill's emphasis on obesity as a disease,
Yes.
not just a lifestyle choice.
Yeah.
What are your thoughts on that framing?
I think it's a really important shift.
Yeah.
By recognizing obesity as a disease,
Okay.
we kind of move away from this blame and shame,
Right.
which can be so counterproductive.
Right.
It acknowledges that there are these complex biological and environmental factors at play.
Yeah.
And it opens the door for a more compassionate and comprehensive
Yeah.
approach to treatment.
Yeah, it makes a lot of sense.
Yeah.
It's about understanding the science behind obesity
Yeah.
and recognizing that it's not like simply a matter of willpower.
Right, exactly.
Yeah.
And the bill's findings really support this.
Okay.
It mentions that over half of Medicare beneficiaries
Yeah.
are managing 5 or more chronic conditions yearly.
Wow.
So addressing obesity
Right.
could really have this ripple effect,
Yeah.
improving overall health outcomes and reducing healthcare costs across the board.
So we've talked about kind of the how of the bill,
Right.
but it also addresses the why
Yeah.
by explicitly recognizing obesity as a disease.
Yeah.
But, even with the best intentions, there's
Yeah.
always that question of whether a bill will actually achieve its goals.
Right.
How did the Treat and Reduce Obesity Act propose to actually measure its effectiveness?
That's where data collection and evaluation come in.
Okay.
So the bill actually mandates regular reports to Congress,
Gotcha.
detailing the progress, the challenges,
Okay.
recommendations for improvement.
Yeah.
So this ongoing monitoring is really crucial for
Right.
any program,
Right.
especially one with such potentially significant impact.
That's reassuring.
Yeah.
It shows that they were thinking about that.
Right.
That the bill's authors
Right.
recognize that this is a complex issue
Absolutely.
and that it requires like careful monitoring
Right.
and potential adjustments along the way.
For sure.
What kind of data do you think would be most important to track?
Well, I think first and foremost,
Yeah.
we'd want to see if the bill is actually leading to a reduction
Right.
in obesity rates
Yeah.
among Medicare beneficiaries.
Of course. Yeah.
But beyond that, I think it would be important to track things like
Okay.
access to treatment,
Right.
patient satisfaction,
Okay.
and, of course, the impact on healthcare costs.
Those are all really important metrics.
Yeah.
And it sounds like the bill was designed
Right.
with a certain level of flexibility,
Yeah.
allowing for adjustments based on real-world data.
Exactly. It's not about setting a rigid plan in stone,
Right.
but rather creating a framework
Yeah.
that can evolve as we learn more
Right.
and adapt to changing circumstances.
Yeah. I'm also curious about the long-term vision of the bill.
Yeah.
Did it specifically address that projection
Yes.
that nearly half of all Medicare beneficiaries could have obesity by 2030?
It did. The bill definitely highlighted that projection
Okay.
as a major cause for concern.
Right.
It really underscored
Yeah.
the urgency of taking action
Right.
and the potential consequences of inaction.
Yeah.
So the hope was
Yeah.
that by expanding access to treatment
Right.
and promoting a better understanding of obesity as a disease,
Okay.
we could start to shift that trajectory.
So in a way, the bill was not only about addressing
Right.
current challenges of obesity,
Yeah.
but also about trying to prevent a potentially even bigger crisis
Yes.
down the road.
Exactly. It was about taking a proactive approach, recognizing that early intervention and prevention
Right.
are key to achieving long-term success.
That makes a lot of sense.
Yeah.
It's about investing in a healthier future.
Yeah.
Not just for individuals, but for society as a whole.
Yeah, it really feels like this bill was trying to be forward-thinking,
Right.
like tackling not just the immediate problem,
Right.
but also trying to head off a potentially even bigger crisis down the line, right?
Absolutely. And that's where things get even more interesting,
Oh,
The bill doesn't just stop at treatment.
right.
It also calls for more research
Yeah.
into the causes of obesity
Right.
and the development of new prevention strategies.
So it's acknowledging that.
Yeah.
We still have a lot to learn
Exactly.
about this complex issue.
Yeah, we're still uncovering all this stuff, the
Yeah.
interplay of genes, environment, and behavior.
Right.
And as we, gain a deeper understanding,
Yeah.
we can develop even more effective and targeted interventions.
That's exciting.
Yeah.
It feels like we're on the cusp of some major breakthroughs
I agree.
in how we understand and treat obesity.
Yeah, there's a lot of promising research happening right now.
Okay.
For example, scientists are exploring the role of the gut microbiome
Right.
in weight regulation.
Yeah.
And there's growing interest in personalized medicine approaches, too,
Right.
tailored to an individual's unique genetic makeup and lifestyle.
This deep dive has been eye-opening.
Yeah.
We've uncovered some potential game changers in how we approach,
Right.
this whole obesity crisis,
Yeah,
from expanding access to treatment to
Right.
investing in research and prevention.
absolutely. It's been a fascinating discussion.
Yes.
And I think, what makes this bill so compelling to me is that it recognizes that there's no one-size-fits-all solution.
Right.
It takes this multifaceted approach,
Yeah.
addressing both the individual and societal factors
Right.
that contribute to obesity. Yeah, it's about empowering people, right?
Absolutely.
With the knowledge, the tools, and the support they need
Yeah.
to make healthy choices.
Right.
But it also recognizes that
Yeah.
we need to create environments that make those healthy choices easier.
Absolutely. Well said.
Yeah.
It's about creating a culture of health
Right.
that supports individuals in their journey
Yeah.
towards a healthier lifestyle.
So to our listener out there,
Yeah.
we've explored the Treat and Reduce Obesity Act of 2021.
Right.
It was, it was a bold attempt
Yeah.
to tackle a complex and challenging issue.
Yeah.
And while it ultimately didn't become a law,
Right.
it sparked important conversations.
Absolutely.
And I think it laid the groundwork
Yeah.
for future efforts to address this obesity epidemic.
And it raises some important questions for all of us to consider.
Yeah,
What role can each of us play
right.
in creating a healthier future
Yeah.
for ourselves and our communities?
Mhm.
How can we advocate for policies
Yeah,
that support healthy choices
right.
and make it easier for everyone to thrive?
Those are great questions to ponder.
Yeah,
This deep dive has given us a lot to think about.
it has.
And we hope it sparks some ideas for you, too.
Yeah, me too.
Thanks for joining us.